are free. New rules will kick in requiring new private health plans and some existing ones to provide a number of screenings and services without charging a copay. Joining us with more details on this, health care expert Andrew Rubin. Good to see you.
Good to be here.
All right, so what are the conditions that there would be no copays?
So I think this is pretty exciting stuff. Remember, healthcare reform was not just healthcare insurance reform. It was about reforming a healthcare system, which includes taking costs out of the system. So the government basically believes that by covering co-insurance, waiving co-insurance and deductibles for certain screening services, they'll actually be able to save some money in the long term. So basically what they're saying is a woman over 40 can get an annual mammogram and she won't have to pay any co-insurance and deductibles for that service. Colonoscopies for people over 50, wellness visits for children, blood pressure screenings, cholesterol screenings, things like that.
All right, so here are some of the items: blood pressure tests, prenatal care, diabetes tests, wellness visits for infants and children, routine vaccinations, cholesterol tests, and many cancer screenings, as you just mentioned, with mammograms. How can doctors' offices and maybe even medical clinics or hospitals afford this?
Well, remember, so what the government's doing is they're basically saying the insurance companies have to pick up the cost of this service. So the doctors aren't actually going to be eating the difference in the copays and the deductibles. The insurance companies are going to have to cover the visit in full. And most estimates put this as costing about 1% more for the premium cost to an employer insurance or a private insurance company for covering these costs in terms of more people seeking these out. Okay. It's also important to remember, you said this in the beginning, certain people are eligible, and I get this question all the time. They hear us on TV or on the radio and they say, I don't know how to access this service. This only applies to people who are applying for a new health insurance plan, or if you get your insurance through a large group employer, if they change their insurance plan. They're called grandfathered plans. And many large employers, are not changing their health care plans this year. So if you get your insurance through your employer and they haven't changed their plan that much, you may not actually get this free service.
Wow, okay, so now there are some other free services or no-charge services, which include like stop smoking counseling, screenings and counseling for obesity, and HIV testing.
Right. Again, the goal here is that a lot of people in this country don't seek out health care coverage or services because they can't afford to actually pay that deductible or co-insurance amount.
Right.
A lot of private employers there have been a lot of private studies, in this country by large employers where they've actually invested in their own employees covering these costs, and they found that in the long term it saves money. So the government's basically saying, well, if the private sector has done these pilots, it's time for us to step in and figure out if we can save some money by keeping people healthy, getting them to the doctor sooner, understanding when they're sick sooner, so that maybe people will take care of themselves better in the future. And I think there's enough evidence to suggest that this works. All
right, and there are other measures of kind of cause and effect. So what happens when, for example, these co-pays are slashed?
Well, again, think about this. You want to go get your office visit or preventative screening mammogram, but it's going to cost you $50 and you're worried about putting groceries on the table. Right. Well, now a woman over 40 doesn't have to worry about that. They can go and get this, they can go get the, the mammography screening, and they can still they can still pay for groceries that month. Another catch here, it doesn't cover the cost of treatment if they find anything. Then regular insurance rules apply, and the cost of, whatever happens to you afterwards, if they do find something, regular insurance rules apply, which means you'll have co-insurance and deductibles.
Okay, as a result, already some of the biggest insurers are reacting to some of these healthcare reform rules. They're promoting plans with reduced premiums, for example, but of course there are some real trade-offs because it might mean that you don't get to choose your doctor.
Frederica, this has sort of been happening, I'd say, over the past year or two. Listen, one of the ways to reduce costs is to tightly manage care for people. And, they tried this back in the 90s with HMOs, restrictive HMOs, where you could only go to your primary care doctor before you went to a specialist and you had to be a network. But the healthcare marketplace was different back then, and America rejected that, and they liked the freedom of choice. But now healthcare costs are skyrocketing. We got healthcare reform. We're going to have a lot of Americans entering, the healthcare system with new insurance. And one of the things insurance and private employers are looking at doing, again, is getting back into that tighter managed network where the insurance companies offer all the services that have to be offered, but they do it with physicians and hospitals where they've negotiated better rates for them, and they'll keep the members within those networks. We'll see if it works, but because it failed last time. But I think America has we may have to actually embrace this if we're really looking to save some money in the long term.
All right, healthcare expert Andrew Rubin, thanks so much. Good to see you again.
Good to be here.